On Health Alert, today is Oral Health Day, World Oral Health Day. They say a happy mouth is a happy life. So if you're not keeping good oral hygiene, know that it can negatively impact your life. But I've been joined in the studio by Dr. Louisa Satekla. She is the FDI Global Ambassador and an oral health doctor. You're an oral health doctor, right? Yes, she's keeping all of us smiling happily. And Dr. Edward Ohene-Marfo, he's the University of Ghana Dental. He's with the University of Ghana Dental School and a dental public health specialist.
Yes.
Good morning, lady and gentlemen.
Good morning.
You're welcome. Why is it important for me to observe good oral hygiene?
So, good oral hygiene, I think we all know, not only affects us, but it affects those around us. When you have issues like bad breath and things like that, you probably may be the last to know because everyone else around you experiences it firsthand before you may be told that you have bad breath. So it's important for us to keep good oral hygiene or good oral health practices so that we not only take care of ourselves, because there's a link between oral health and then our overall well-being. And so the theme for this year is actually a happy mouth, a happy mind. And so, it's important for us to take care of that for ourselves,
But
and then also to maintain our relationships.
Happy?
Yes, so that is why we're here, to educate us. You have to make sure that you're doing all the right things, brushing twice a day, flossing, visiting your dentist. You should be aware of what's going on in your mouth. If you find a cavity developing in your mouth, you don't sit and wait. You don't just take a painkiller when you start experiencing pain. You need to go out there and seek for professional help.
How many times do we need to visit our dentist?
So at least twice in a year, that's what we recommend.
Hey.
At least, have you gone this year? The way she's laughing, she has not been to the dentist this year.
I haven't been this year.
So at least twice in a year.
Not once?
No, at least twice.
Okay, so you do first quarter, and then the final quarter.
Yes, that makes it easier.
Okay, okay. You're an FDI Global Ambassador. What does that mean, and what does it entail?
Okay, so my role as a global ambassador is to create more awareness about World Oral Health Day and beyond World Oral Health Day, about oral health in general, oral health awareness. And so I'm supposed to cut across all the different age groups and bring people's attention to the importance, because sadly in this part of the world, oral health is seen as a luxury. People would only go to the dentist when they're in pain. You don't find people routinely going to see the dentist, and that is very unfortunate because a lot of the systemic diseases first manifest in the mouth. Your dentist may be the first person to pick up something that's going on in your body, like a kidney disease, just by looking in your mouth, HIV, just by looking in your mouth. Yes, a lot of people don't know that. And so it's important for us to use our voices, use the following we have to educate people about things like this, and then create awareness about it as well.
You talk about the fact that we need to create awareness, but they say charity begins at home, and so very often we need to start young. You have met the education minister, and you've had talks about introducing oral health, at least at the very young age in schools.
Yes. That I had a meeting with the Honorable Minister, a very fruitful meeting. He was very excited about some of the recommendations that I made, because if we want to see some improvements in the next generation, what better way to do it than to start teaching them while they're in school? Because we've done a lot of outreaches, and we find that there's a lot that the kids do not know. So if we're able to teach them in school, and then this is for everyone, regardless of their social class, if it's being taught as part of the curriculum, then they'll be more equipped with the knowledge and the tools for better oral health. And so after my first meeting, I've also had a meeting with the Director General for the National Curriculum Council, Professor Yayo, and he's also very excited. And so we're seeing how we can merge with the Ghana Dental Association to involve oral health education into our national curriculum. So that's something that I'm very excited about, and I know it's going to eventually work out.
Okay, I mean, it's something that will be quite interesting to look forward to. At least we help them at a younger age so that it becomes a part and parcel of their lives as they grow. But let me come to you, Dr. Marfo. Tomorrow is World Oral Health Day, right?
Yes.
And what is the purpose of it?
So, World Oral Health Day is a day that we've set aside to educate people, make people aware of their oral health, to empower them so that they can take absolute control over their oral health. like my colleague has stated, oral health has a lot of effects on the general well-being. And oral health has a relation with mental health. Last year was a happy mind.
So
Great. So last year we did a happy mind, a happy body. And this year we are doing a happy math, a happy body. And this year we are doing a happy math, a happy mind. So we've dealt with the physical things that we can see, and we are going to the ones that we can't see. That's our mental health. So oral health and mental health, they affect each other. Mental health can affect oral health. Oral health can affect mental health. I'll start from the mental health aspect. Mental health can affect oral health in a way that if someone has a mental health condition, maybe the person might not be taking good care of the oral health. Some medications that they take in treating some of the mental health condition can cause dryness of the mouth. We are not saying they shouldn't take it, but as soon as you are taking it and you start experiencing any dryness of the mouth, you have to talk to your doctor, and you have to also talk to your dentist, so that we get to a stage that everybody will be fine, including your mouth as well as your mental health. Now, this is how oral health can affect mental health. If you have pain in your mouth, it causes stress, discomfort. Assuming as I'm talking,
you're not able to be productive, you can't focus.
Yes. Assuming as I'm talking now, as you're on stage, assuming you've lost an anterior tooth, it will affect your beauty.
And even your confidence.
Great. So confidence, self-esteem is there. Social isolation, social anxiety. You may not want to go out. And when we take it into the children, it means that these kids will not do well in school. They will not be confident of themselves. They know the answers, but they can't say it because they feel people will be laughing at them because of certain things they have in their mouth. So we realize that once, I won't say we've dealt with it, but once we've introduced in code the world to oral health and the body, which is the physical last year, then this year we should look at our mental health. Then people would know and appreciate the fact that indeed oral health really affects our mental health. So if you have a happy mouth, it will reflect in a happy mental health.
That's a good one. But what constitutes poor oral health? Because very often we think that, once you have a smell from your mouth, that's when you have poor oral health.
So I would say poor oral health is anything that affects your mouth and doesn't make your mouth healthy. It starts from having, as you said, bad odor from the mouth, having cavities in your mouth. Sometimes it's not only cavity, like Louisa's specialty. Maybe the teeth are not arranged well. So you may not have pain, you may not have bad breath, but then
you don't have proper dentition.
Great. So then that also affects you. It goes beyond that, because our oral health goes beyond the teeth or the mouth. The facial muscles, the bones of the face, the salivary glands, even sometimes it stretches to the neck. So it is so big, but then we just see it as the teeth and the teeth alone, no. But it goes beyond that. So there are a lot of conditions that maybe we can't talk about here. That means that maybe the individual isn't having a good oral health.
I wish you can, touch on very few. You said there are a lot of conditions.
Great. So, when we even take from the mouth, apart from cavities, the gum covering the mouth and the bone form something we call periodontium. So you can have a periodontal condition. Now, that condition might not necessarily cause pain, but you may be losing your tooth or your teeth. So then it will be like, our people say that when I gave birth, I lost a tooth because some hot air passed through my mouth and I lost a tooth. No?
Is that a myth?
It's a myth.
It's a myth, yeah.
Oh, really?
Yes, it's a myth.
That's some form of education there.
Yes, it's a myth. Because what really happens is pregnancy can induce periodontitis.
Okay.
So then for some people, maybe they've not visited a dentist, they already have an underlying periodontal condition. Okay. Then the pregnancy will precipitate the condition. So by the time you are done, maybe one of your tooth or your teeth is actually mobile. So then they'll say that, I vomited after giving birth, and after I vomited, I lost a tooth. No, it's because the pregnancy has caused a periodontal condition. Now that periodontal condition makes the tooth weak, because I said that the gum and the bone and some other things form the periodontium. So once there's a periodontal condition, the tooth can remove. For some people, it won't cause pain, but then you've lost a tooth.
Dr. Satekla, for a good dentition, if you have white teeth, does it mean that you have good dentition?
So that's another myth. We assume that if your teeth are white, then it's healthy. Or if your teeth are not white, it is not healthy. It's just like your complexion. Not everyone is going to be light-skinned, and not everyone is going to be dark-skinned.
Sure.
However, there's something called plaque and calculus, which is makes your teeth look yellow. That is not normal. So that's why you have to visit your dentist to have it professionally cleaned. But then with the shade of your teeth, not everyone can have perfectly white teeth. I mean, in this new day and age of social media, everybody wants to look like who they see on TV, and so it's all right to go for, you know, other aesthetic treatment to get your teeth whiter. However, there is nothing wrong if your teeth are naturally not as white as maybe someone that you see, you know, on TV. First of all, consult with your dentist to make sure that you do not have plaque or calculus, which is giving you a yellow discoloration. If your dentist tells you that your teeth are fine, then you don't need to worry about that.
For Ghana, for the celebration of World Oral Health Day, what are we doing?
Okay, so throughout the month, actually, the Ghana Dental Association has allocated the month of March as Oral Health Awareness Month. So from the beginning of the month, there have been so many activities. A lot of dental clinics are offering promotions. There are a lot of screening, free screenings.
Are you offering promotion?
Yes, Charisma Dental Clinic is offering free consultation when you go with the code World Oral Health Day. There's free consultation at Charisma Dental, and I'm sure many other places are offering discounts and things like that. At the University of Ghana Dental School, we're also doing a free screening. So when you go to the car park, there's a tent there with dentists there doing free screening as well. Tomorrow there's a big event happening at the Richard School. Dr. Ohene-Marfo will give us some more information on that. There's a big celebration there.
So the University of Ghana Dental School, I mean, as she stated, most dental clinics in Ghana are doing free screening, reduced treatment, and also the dental schools in Ghana. So for instance, University of Ghana Dental School last week, we were at Anumle cluster of schools. We did free screening, treatment, and our sponsors gave them some toothpaste and brush for them. Within this week, as she said, we are doing free screening on our car park. Today, we have a debate between her school and my school. I went to University of Ghana Dental School. She went to Kenya University. And of course, we will win.
Let's just wait and see what happens today. We'll just show them something small.
Okay. and we'll be looking out for it.
Yes, and tomorrow, we will all be at the Rich School where we will train the students there. We would let the world know what dentistry is about. We introduce the kids to what really means a happy mouth is a happy mind, and as well as the world to know what we are doing in Ghana. When you look on social media, it's actually all the 16 regions in Ghana, various schools, markets. I mean, most of the markets in Accra as well as across the country. We are using the whole month of March. So, for instance, next week, the University of Ghana Dental School alumni will be going to a Buster home, the one at Roman Ridge. We also go to a cluster of schools in Kolegono. There are various things happening. And we are doing all these things not to necessarily go and tell people that you have something in your mouth, but to empower people. Because as public health experts, we want people to own their health. You have control over your mouth. You have control over your health. So I mean, a lot of places, Ridge Medical Center is doing something just behind you. Ridge Hospital, a lot of, I mean, hair place, a lot of places are doing free screening, treatment, and also we are educating people. The most important thing is to empower people to have control over their oral health, and by reflection, their entire health.
How do I have control over my oral health?
So first of all, be knowing, being knowledgeable, having the information. And so that is why we're doing such sessions. If you go to the Ghana Dental Association page, there's so much information there. So first of all, having knowledge of what to do and what not to do is the first key. And so that is why we're trying to empower most of us with the knowledge. And then also taking charge of it, you know, by practicing it yourself. So if we say something as basic as brushing your teeth twice a day goes such a long way. It sounds like it's something we've heard over and over again, brush your teeth twice a day, floss your teeth. But that takes away so much. You know, most of the oral health diseases are preventable. That is why we keep sounding the alarm, because if it's something that could not have been otherwise prevented, you know, it won't be such a big deal. But most of these are absolutely preventable. So that is why we're trying to empower people with the knowledge and say, this is what you need to do, this is not what you need to do. If you go to my social media pages, I have a lot of videos educating people on, you know, basically how to brush your teeth, the tools to use.
That is the most important thing. You know, dentists will say, oh, brush your teeth twice a day. Somebody will brush their teeth in the morning, at night, and then before they go to bed, they are munching on something. Is that proper oral hygiene?
That is not proper practice. It should be, you should brush your teeth after your last meal, because the science behind it, you should know the science behind it. We have bacteria in our mouth. You have bacteria, he does, I do, and it's normal. We have these normal bacteria in our mouth. When we eat food, especially the sugars in the food that we eat, these bacteria feed on those sugars, and then they produce acid, just like how humans produce waste. These bacteria also produce waste, but that waste is in the form of acid. So the more acid that you're being exposed to, your teeth is being exposed to, the more prone you are to develop cavities, and that is how the cavities come about. So if I have, I brush my teeth and I still eat, I have a snack and I go to bed, my mouth is going to be bathed in this sugar the whole night whilst I'm asleep, and these bacteria are having a field day feeding on this food remnants of the food that is still stuck in my teeth and producing the acids and exposing my teeth to these acids. And so over a period of time, I'll develop a cavity. So it's not just the act of brushing your teeth, but you should understand the science behind it so that you know you're supposed to brush after your last meal so that you get rid of all of these remnants of food left in your mouth.
And some people will say, oh, I want to brush. I'll use a very hard bristle to brush so that it takes away every remnant of food.
Sadly, that's another thing that we hear a lot. They say, oh, I feel better when I use the hard bristle. We do not recommend the hard bristle toothbrush. They damage your teeth and your gums as well. So we recommend you use a soft bristle toothbrush or a medium bristle toothbrush. Soft, best. And then it's the technique.
How does it get everything out?
It's the technique. It's really just the technique and not the intensity of your brushing, because you're going to eventually damage your teeth and your gums if you use a hard bristle toothbrush. And also flossing is another important part of our oral hygiene routine that most of us do not do, because remember, when you're brushing the front, the back, and then in the case of the posterior teeth, the top. But you're missing the inner part. So you're missing about 30% of your tooth surfaces when you're just brushing. When you use your floss, you're able to go in between the spaces and reach the part of your teeth that the toothbrush cannot reach. So that is why it's also another important
How many
part.
times should one floss?
Okay, Dr. Marfo would say.
So for me, I'd say you can floss after eating, after every meal. And so it takes us back to the brushing that we were saying. There is a 2x2 rule. You have to brush twice a day, right? One in the morning and the last thing before you sleep. You have to brush at least a period of 2 minutes. So it means once you are brushing, you can just time yourself so that you don't rush through. So a period of...
And you don't overdo it, because very often you find people in the shower and they brush more than 5 minutes.
Well, so I mean, from our studies, a minimum of 2 minutes should be enough for everybody, and you brush twice. And you floss after every meal. I'll say every meal because for some people, after eating every meal, they may find some food particles in between their teeth, and they may feel uncomfortable. Or if you want to wait till evening, the hours, like Dr. Louisa stated, it's the time the food particle or the sugar substance is staying in your mouth with the bacteria that can lead to the cavity or the caries. So then once you floss after every meal, it helps. That is if you can, or if you're at a place that you can really do so, because it will be some way, I mean, flossing in front of our audience this morning. Yes, but I mean, as long as you can after every meal, just try and floss. And you can also switch and swallow. I mean, we will eat within the day, you may take snacks, and you may not be brushing within the day because maybe you're at work. So once you are drinking water, I just do a little bit of switch and swallow, which reduces the amount of...
Oh, you swallow?
Yes.
Okay.
Because everything in your mouth is yours.
I like that.
And of course, what is in your mouth is part of the food nutrients, right? So once you switch and you swallow, then it is reducing the amount of, let's say, sugary content in your mouth. So mostly for our children, I noticed that when you tell them that don't take sweets, that's when they take it. Even in your home, maybe they won't take it, but in school you are not there. So then once you teach them brushing twice a day and they switch and swallow, even if they want to eat their chocolate or their sugary stuff, which we don't really recommend, once they do the switch and swallow, it reduces the amount of sugar or sugary substance in their mouth, which can lead to the dental cavities.
And then the tongue?
Another important part of your oral hygiene routine, because with the anatomy of the tongue, especially at the back, there are some deep grooves or crevices in the tongue, which is a perfect hiding spot for bacteria. And these bacteria produce bad breath. And so it's important that you brush your tongue. We also have tongue scrapers, which are perfect for getting rid of all of this, the food debris and then the bacteria on your tongue, because these bacteria hide there, and they also produce, just like the ones that produce the acids, these produce gases. So these gases are called volatile sulfur compounds, and when you open your mouth to talk, it can be perceived on the outside as bad breath. Yeah. So brushing your tongue is another very important part of your oral hygiene routine that you should not take for granted.
How often should we discard our brushes and our tongue scrapers?
Okay, very important. At least every 3 months, you should change your toothbrush.
What are the tongue scrapers?
Same. Okay. So with the tongue scrapers, we actually have the disposable ones. So with the disposable ones, it's easy to discard after every use, but we also have some that are metallic and all of that. And ideally, I would always say that use the manufacturer's instructions, because we have different brands. And so it's best to go with each manufacturer's instructions so that you're not, doing the wrong thing for a different brand as opposed to what you may be used to.
And another phenomenon I have realized is the reusing of floss. People floss, and then the next minute they're putting it inside their handbags, and when they eat again, they reuse it.
So that's the thing. We have the thread-like one, and then we also have the one that you find on the stick. And it's so cheap, it's so readily available. So once you're done using it, just discard it, and then use another one when you're ready to floss again. I think that's the best thing. So if you know you're heading out, and we have these very small ones that you can just put in your purse, in your pocket, so that it's easy for you to use and discard. That's the best practice.
So please stop reusing your flosses. I find it very disgusting.
Yes.
Anyway, your final words as we mark World Oral Health Day, especially tomorrow.
Okay, so like I said, it's a great opportunity for you to take advantage of the different discounts that are going on with the different dental practices. University of Ghana Dental School is doing free screening. So this is an opportunity. If you haven't been to the dentist yet this year, this is a great opportunity for you to take advantage of all the freebies going around, and then visit the dentist, and also take charge of your oral health. Is very important. You'd be surprised how big of a difference it would make if you make certain little changes. If you're not brushing twice a day, just make it a conscious effort to start brushing twice a day. Go and get a floss, go and invest in a good tongue scraper. Things like such little changes go a long way. And so we are inviting all of us to the University of Ghana Dental School to the debate where KNUST will be winning today. And then also tomorrow to the Research School where we have another event with Pepsodent Ghana. And also there's an official song by the World Dental Federation for World Oral Health Day this year called A Happy Mouth, A Happy Mind. And there's currently a dance challenge going on social media. So I'm inviting all of us to join in on the dance challenge. If you go to my page, you see I tried my best and I've done that. I'd like to see your videos as well. The official creators of the dance challenge are the Accra Boys. So you can head over to their page. They have a nice tutorial video. Jump on the challenge, tag us, tag the GDA Ghana, tag World Oral Health Day, tag myself, and we'll be happy to repost. And so happy World Oral Health Day to everyone.
Dr. Marfo.
Yes, so I'll say that 2 by 2 brush twice a day, the last thing you do before you sleep. Make sure it's a minimum of 2 minutes. And also remember that you are supposed to visit your dentist twice in a year. Even if you don't want to visit your dentist, I mean, you don't have enough funds. Every year, 20th of March, we have World Oral Health Day celebration, like what we are doing tomorrow. Take control over the atmosphere and go and have yourself screened and have a free treatment if possible. Then again, we just want the world to know, like we did last year, your mouth affects your body. This year, we just want the world to know that your mouth affects your mental health. Take good care of your mouth. Once you have a happy mouth, you have a happy mental health. And also for my colleagues in dental school, we will just show KNUST Pepe.
Anyway, thank you very much. That's Dr. Edward Ohene-Marfo. He's a dental surgeon with the University of Ghana Dental School, and Dr. Louisa Satekla. She's a dental surgeon as well with Charisma Dental and an FDI Global Ambassador. That's it for Health Alert.